I'm going to prime an IV tubing and spike it. And so what I'm going to be using today is going to be my my tubing, which is right here. And I'm going to go ahead and spike it with my, I'm going to go ahead and put this into my solution. So what you want to do is after you make sure that it's labeled, because it's very important to label it, it's not expired, there's no nothing wrong with it, we can go ahead and get it started. So what we're going to do is make sure you never touch anything together. Make sure your tubing is not kinked, it's all working good, and the caps are on it. So we're going to go ahead and remove, once we do that, we're going to remove the cap, but we always make sure you perform hand hygiene first, because this skill is aseptic and it requires aseptic technique, and we want to be very careful not to contaminate anything that we've used or taken the caps off, because this could cause an infection. And so before I do anything, I want to make sure that I confirm the right solution that I'm going to give to the patient. Make sure that the physician order matches with the solution. We have the right patient. We have our IV tubing, and make sure the bag comes with a label so I can label it. That's very, very important, so we don't get confused on what's in the bag or not. So the label will have the start date, it'll have the HR, that'll be the time, because most, the key point is to remember is that most hospitals, depending on your hospital CDC requirements, most hospitals have 72 to 96 hours to change the tubing. So that's why it's very important to label the tubing, and you will want to label the tubing and put the tubing on right here, so then we can see it, okay? And so once we do that, and everything is, everything, the kinks are taken off, the tape, everything that it comes with, we will go ahead and make sure it's not broken, or the tubing, everything's working, because once it expires, we need to have the incoming nurse change it. Okay, so so once we apply the label, and we have the to the tubing by the drip chamber, right here we'll put the label, and make sure you label it with military time, and the date that you started it. So now we're going to go to the IV pump, and we're going to get the roller clamp. Before we start anything, we have to make sure that the roller clamp is locked, so we don't get none of the fluids coming back once we start the fluid, okay? So make sure the roller clamp is locked, so we don't have a mess of, because once we penetrate the bag, we don't want all the fluids rushing out. So, and then we also want this cap on, so it stays, it doesn't get contaminated, okay? And this is what you're going to put onto the IV central line. But, so you want to wear gloves, be careful not to touch anything and not to contaminate it. So we're going to remove the cap, and once we wear the gloves to prevent contamination of medication and to prevent of contamination of infection as well. So we're going to hold the IV bag like this. It's going to be upside down. We're going to remove this, the top lid right here. And then once we have this in our non-dominant hand, we're going to take this, after we pull the stopper off, we're going to remove the cap of the tubing, and we're going to go ahead and penetrate the spike into the spiking port, turning it so once it goes all the way in, you have to twist and put some pressure onto it, and use your strength so nothing can come out, okay? So once we're done with that, we can turn it up, and we can go and put it into the thing and hang it So once we have it like this, we can hang it, but nothing's coming out because the clamper is on, okay? So that's the reason why it's not coming out. So once we go ahead and squeeze and we get enough out, we are not going to have anything come out quite yet until we remove the clamper and open the clamper. And so this is what called the priming. So once we get the priming, we want to remove all the air from the tubing. So once we open it up, we can open it up, and now the water is coming through. Let's see. So now that it's coming through, let's get some more and make sure that it's not clamped through. So once it's going through and it's dripping, and we get something out here and all the air bubbles are out right here, we are going to make sure that we just let it drip into the sink or something so we don't get any air bubbles, okay? And so you're just going to keep letting it drain until the air bubbles go out. Double check the line, make sure that there is no massive air bubbles. If you have to reflush and flick the line so the air bubbles won't go to the patient. So after you have primed your tubing, you're ready to connect your bag to the IV pump, which will control the rate of how fast your bag will drip in. So connect the tubing to the patient, which will be this, and you're going to have this hung up, and you're going to connect the tubing to the patient, which is going to be the IV. And once we connect it to the IV that's already here, we already have this to the patient, we will connect this and screw it on tight and make sure before we do this that the clamp the clamp roller is all the way closed. So then we have that, and there you go. That's how you're going to prime your line, just like that. Okay. Okay, so the IV tubing, you must make sure that that the bag comes with the label so you can label it. And this is only this is for the incoming nurse to see if it's expired, if it needs to be changed. And the CDC requires, like I said in the video, within 96 hours. Most hospitals are 72 hours, so you have to check with your hospital rules and regulations. But this is the reason why we do the labeling, and then to also who did the tubing, the placement as well. So once you open the tubing, you make sure that there's no kink in the tubing, and remove any tape or anything, and everything is intact. Different sites for IV. There's there's the hand, which is the dorsal arch and veins, the wrist, the volar aspect, the cubital fossa, median antecubital, the cephalic, and the basilic veins. The foot, the dorsal arch, the leg, the saphenous vein at the knee. These are all the different sites for IV's placement. So different types of IVs, there's an IV push. An IV push or a bolus is a rapid injection of medication. A syringe is inserted into the catheter to send one-time dose of drugs into your bloodstream. IV piggyback is an intravenous or piggyback or secondary infusion. The administration of medication that is diluted in a small volume of IV solution through a primary infusion line, just like the picture shows right there. So IV discontinuation, to do this, you will hold the IV tube in your dominant hand and use the other hand to clamp the tubing to occlude the fluids from coming out. The next thing you'll do is you'll put pressure on the site, and if possible, raise the arm so the IV site is above the level of the heart. Hold pressure until the bleeding has stopped. And the next thing you'll do is dispose the fluid bag and tubing according to facility policy into the appropriate disposal receptacle. So now that when you finish the procedure, you will inform your patient that you are done, and you will ask them if they have any questions or concerns, and you will hand your patient the call light. You will lower the bed, put the bed rails up, advise your patient when your return will be, and once you do that, you will hand hygiene, dispose of PPE and used equipment.